Hi, let's talk about nitroglycerin and all you need to know for your exams and NCLEX. This is a very famous medication and you must know about it. Nitroglycerin is a potent vasodilator used for angina or chest pain in coronary artery disease. Nitroglycerin converts to nitric oxide, which causes smooth muscle relaxation in the blood vessels and causes vasodilation, which eventually causes reduction in the preload and therefore reduction in the workload of the heart and oxygen demand. When do we give it? We give sublingual and spray nitroglycerin during acute angina attacks. How do we give it? First things first, we have the patient sit down or rest, stop what they were doing, and then take one tab sublingually or one spray. Do not chew, do not swallow. Wait for 5 minutes. If no pain relief, call 911, then take the second tablet. The patient can take up to a maximum of 3 tabs 5 minutes apart. Do not exceed 3 doses. If you do, it can risk unopposed vasodilation and deadly hypotension. When to use the nitro patch or ointments? Remember, we have the sublingual and spray, which is used during acute attacks, and then we have nitro patches and ointments, which we use for chronic prevention of stable angina. So we use nitro patch and ointments for daily prevention of chronic stable angina. Never used in acute chest pain. Always wear gloves during application to prevent absorbing it into your skin, especially if you're the nurse giving the ointment or the patch. Tell the patient to observe 10 to 12 hours daily nitro vacation to prevent drug tolerance. When is nitroglycerin contraindicated? One of the contraindications is hypotension. Generally, do not administer nitroglycerin if the patient already has a low blood pressure, systolic less than 90. It's also contraindicated when the patient has used a phosphodiesterase inhibitor within the last 24 to 48 hours. The most common type of phosphodiesterase inhibitor is the sildenafil or the Viagra, often used for erectile dysfunction. It's also contraindicated due to the risk of life-threatening hypotension. Another contraindication is if the patient is suspected to have a head trauma or increased intracranial pressure. This is because vasodilation of the veins in the head can also worsen the ICP. And of course, if patient is allergic to the nitroglycerin. Common or expected side effects of nitroglycerin. I always say them the three H's of nitro. These are expected and are usually a sign of medication is working. Teach your patient about these expected signs and symptoms so they do not freak out and call 911 thinking something is going wrong. Number one, headache. Often throbbing headache due to cerebral vasodilation. If the headache is unbearable, the patient can ask the provider to reduce the dose. Hypotension and orthostatic hypotension. Monitor blood pressure before and after administration. Advise slow position changes to prevent dizziness and falls. Number three, hot flashes, facial redness. So the patient will have, after having taken the nitro, they may have feel sense of hotness and facial redness. It's perfectly fine. It's an expected side effect. When do we need to tell the patient to call 911? If there's no pain relief even with the nitro use, if the patient is having an anaphylactic reaction to the medication. How do we store nitro? Note that the tablets are very sensitive to heat, light, and moisture. Store in the original dark glass container with the cap tightly closed. Do not store in the kitchen or leave in the car. The heat can mess up the potency. Replace the bottle every 3 to 6 months after opening, as the medication can lose potency after the 6 months. Transdermal or patch ointments used for long-term prevention, not for acute attacks. And like I said, always wear your gloves. Rotate application sites daily to prevent skin irritation and ensure consistent absorption. Provide a daily nitrate-free or nitrofication, usually by removing the patch at night to prevent development of drug tolerance. IV administration of nitro. If you have in the hospital setting and you have to give nitroglycerin IV, use a glass IV bottle and specialized non-PVC tubing because the medication absorbs into standard plastic tubings. Patient education. Advise patient to limit alcohol use as it can worsen hypotension. Patients with transdermal patches should remove them before an MRI, and if you have to defibrillate your patient, make sure they do not have the patch on because this can burn your patient's skin. Thank you for watching. Like and subscribe if you have not done so that the YouTube can help push my channel to more students who can benefit from this content. I will see you on the next one, and bye for now.